That deep nagging pain in your hip and knee very often comes directly from problems with the quadriceps muscle. Give me just a few minutes and I'll walk you through the main causes of this pain. And then I'll give you simple step-by-step techniques to release this muscle and shut that pain down for good, right there at home. I'm Dr. Chernov, and let's get rid of this pain together, starting right now. The quadriceps femoris is the single largest and heaviest muscle in the entire human body. Just think about it. It weighs a full 50% more than even the gluteus maximus. It's made up of 4 distinct parts: the rectus femoris and the vastus medialis, vastus lateralis, and vastus intermedius. At the bottom, all 4 of these heads converge and join together. They form one powerful common tendon that attaches directly to the patella and through it down to the tibia. And that is precisely why problems in your thigh will always send pain shooting straight into your knee. At the top, however, they each attach differently. The 3 vastus muscles anchor to the femur and control only the knee joint, but the rectus femoris is truly unique. It runs all the way up, crosses the hip joint, and attaches directly to the bones of the pelvis. It works together with the iliopsoas to help you flex your leg at the hip. Trigger points, those painful, hardened knots deep inside the muscle tissue, are extremely common in the rectus femoris. And here's what makes them so particularly tricky. The trigger point itself can be sitting high up, right at the level of the hip joint, yet the referred pain it sends travels deep down into your knee, concentrating right around the patella and through the lower portion of the thigh. This relentless aching pain can be especially brutal at night, literally robbing you of any decent sleep. Sometimes these trigger points also hide down low in the muscle right above the knee, radiating pain directly into the joint from there as well. Inside the vastus medialis, the muscle running along the inner side of your thigh, there are 2 primary high-risk trigger point zones. The first one sits closer to the knee and projects pain directly across the front surface of the joint. The second sits slightly higher up, and it produces that deep aching pain along the inner side of the knee and lower thigh. If you leave this untreated, the consequences can become genuinely serious. The pain can suddenly switch to a sharp wave of weakness, and in that moment, your leg simply buckles right at the knee. That makes it dangerously easy to lose your balance and get injured on perfectly flat, level ground. On top of that, chronic tension in this muscle can physically drag your patella inward and upward, seriously disrupting the proper mechanics of the entire knee joint. The vastus intermedius hides underneath the rectus femoris, which makes finding trigger points inside it genuinely difficult. Pain from these hidden trigger points travels down along the front and outer side of the thigh all the way to the knee. But the most intense focal point of pain is usually felt right in the middle of the thigh itself. If trigger points have formed in the upper portions of the rectus femoris and vastus intermedius, your leg can suddenly give way right at the hip joint itself. This typically happens at the exact moment when you're trying to straighten your leg and you're fully transferring your body weight onto it. Another very telling sign of problems with this muscle group. You find it genuinely difficult to fully straighten your leg at the knee. This shows up most consistently when you try to stand up after sitting in one place for a long period of time. In the vastus lateralis, trigger points don't appear one by one. They cluster in groups all along the entire lateral surface of the thigh. The pain they generate can spread across the whole outer side of the thigh and into the outer portion of the knee. If the trigger points are active up in the higher regions, nights become absolute torture. You simply cannot lie on your affected side and fall asleep. Beyond that, when this powerful muscle stays locked in chronic tension, it literally yanks the patella outward and upward. The result is that the joint can effectively seize up and the knee loses a significant amount of its normal mobility. Here is how the pain maps out across these 5 distinct zones. The first group hits directly into the knee joint itself, sometimes even radiating behind the knee. The second group sits slightly toward the back. It creates pain along the side of the patella that spreads in a wide band upward along the thigh and downward along the outer side of the lower leg. Third zone generates pain across the entire posterolateral thigh and shoots into the outer edge of the popliteal fossa. The fourth group sits right in the middle of the thigh. It produces the most severe and debilitating pain, running all the way from the pelvis down to the knee. And finally, the fifth zone lives at the very top of the muscle. It causes localized pain that concentrates only in the immediate area around itself. In his research study, Troedsen examined 35 patients who were suffering from knee pain, and in absolutely every single one, in 100% of those patients, he found painful muscular knots in the lower portion of the vastus lateralis on the affected leg. But the most remarkable finding came next. Out of 25 people who received targeted treatment specifically to this muscle, 24 experienced a complete resolution of knee joint instability. Their knees became stable, strong, and reliable once again. This and other similar studies consistently confirm the phrase that I repeat regularly throughout my videos. If your knee is hurting, yes, your very first step should always be a thorough clinical diagnosis to rule out ligament tears, meniscal damage, and other serious structural injuries. But beyond that, you absolutely must address the muscles and fascia of both the thigh and the lower leg. Start treating them as early as you possibly can. That is exactly what will help you preserve your joints and prevent the development of severe osteoarthritis in both the knee and the hip. So how do you know for certain whether this specific muscle is the source of your problem? Test 1. Checking the rectus femoris. You need to simultaneously flex your leg at the knee while extending it at the hip joint. Stand up straight, draw your thigh slightly backward, and try to bring your heel all the way up to touch your glute. If your heel easily touches your glute, you're in great shape, your range of motion is complete, and the muscle is nice and elastic. Test 2. Checking the remaining 3 vastus muscles. Lie down flat on your back. Raise your bent legs so that your thigh is at a 90-degree angle to your body. In this position, we effectively take the rectus femoris out of the equation so it doesn't interfere with the test. Now wrap your hands around your lower leg and gently pull your heel toward your glute. If your heel touches your glute, congratulations, your muscles have normal length and excellent elasticity. If your heel doesn't reach your glute, there is definitely a problem. And most likely the primary culprit is shortening of that deep vastus intermedius muscle. Trigger points in the 2 other muscles can also restrict this bending motion, but they limit the movement considerably less. To eliminate trigger points in the quadriceps, you need to work simultaneously on 2 distinct fronts. First, remove whatever keeps constantly overloading your muscles and restore proper biomechanics throughout your body. Second, apply deep mechanical pressure directly to the trigger points themselves and then properly stretch the muscle afterward. Let's break down that first point in detail. You need to eliminate any and all overloading of the thigh, both acute and chronic. What does that actually look like in practice? During your recovery period, you'll need to cut back on squat exercises and high-impact sports, basketball, volleyball, soccer, jogging, skiing, inline skating, and cycling. All of these activities place enormous demand on the quadriceps and will prevent it from recovering properly, and absolutely avoid prolonged kneeling. Pay especially close attention to the health of your feet. They are the very foundation that determines the well-being of your knees and hips. You need to actively address flat feet, particularly if your foot pronates and collapses inward. Monitor your own walking pattern. Plant your foot straight and level. Your toes should not splay outward or turn inward. They must point directly forward along the center line of your movement. Now let's move on to the second phase, how to work through these muscles mechanically right in your own home. For this, you'll need either a large foam roller or a regular 2-liter plastic bottle filled with warm water. A firm massage ball also works extremely well for this. Let's start with the front surface of the thigh. Lower yourself down to the floor, facing face down. Place the foam roller or bottle underneath your right thigh. Prop yourself up on your hands and your left leg. Now for 2 to 3 minutes, slowly roll your thigh back and forth up and down. Gently rotate your legs slightly inward and then outward to work through all the different muscle fiber directions. If you land on a spot of intense tension and sharp pain, that right there is a trigger point. Stop directly on it. Hold steady for 30 seconds. Allow the muscle to gradually release and then continue rolling. Want to crank up the pressure? Simply bend your right knee or lift your left leg off the floor entirely and rest it on top of your right. Next, let's move to the lateral surface of the thigh. Roll onto your right side and prop yourself up on your right forearm. Bend your left leg and plant that foot in front of you for balance. Slowly roll along the outer side of your thigh for 2 to 3 minutes, gently shifting your body angle as you go. Found a dense and painful spot. Hold there again for 30 seconds, breathe through the discomfort, and then continue moving. To intensify the pressure in that zone, simply straighten your left leg and lay it on top of your right. And here is the single most important rule. Even if only one knee is hurting, you must work both legs on the foam roller, giving each side exactly the same amount of time. If you want to dig even deeper into those trigger points, bring in the massage ball. You can use either a small or a large one, but I'll tell you right now, for the front and lateral surfaces of the thigh, the large ball is going to be far superior. It's simply much more practical and comfortable to work with. The technique here is this. Find the most painful spot with the ball, transfer your body weight directly onto it, and hold that position for 30 to 60 seconds. There is one absolutely critical element here, and that is your breathing. Don't just grit your teeth and white-knuckle through the pain. Breathe deeply and steadily in through your nose, and with every single exhale, consciously and intentionally, Relax the muscles of your thigh, allowing the ball to sink gradually deeper into the spasmed tissue. Once we've worked through those trigger points, you must stretch the muscle. That step is non-negotiable. Our quadriceps extends the knee, and one of its heads, the rectus femoris, also flexes the hip. So to fully stretch this entire complex, we need to do the exact opposite movement. Flex the leg at the knee and draw the thigh slightly backward. The simplest and safest way to do this is to lie on your side. Bend your top leg at the knee, wrap your hand around your foot, and gently, with no jerking or bouncing, draw your heel toward your glute. What if the muscle is extremely tight, and you simply can't reach your foot with your hand? No problem at all. Grab a regular belt or a towel, loop it around your foot, and use that to gently pull your leg into position. Dial in that feeling of a strong, satisfying stretch running along the entire front surface of your thigh. Breathe deeply and smoothly through your nose. Do not hold your breath. Hold this stretch for 1 to 2 full minutes. Then slowly release your leg and make a few easy, free movements. Simply flex and extend your leg at the knee and hip to restore circulation and blood flow. After that, roll over onto your other side and be sure to repeat this exercise for the second leg. A very similar version of this exercise can be done while sitting in a chair. This is a perfect option if you spend long hours working at a computer. Sit right on the very edge of the chair, bend your leg, grab your foot or lower leg with your hand, and draw your heel toward your glute. Hold exactly the same way, 1 to 2 minutes. This same movement can also be performed standing up, but here you must hold onto a wall or the back of a chair to keep your balance and avoid engaging your stabilizer muscles unnecessarily. There are also more advanced but incredibly effective yoga poses for intense quadriceps lengthening. These include Vajrasana, the diamond pose where your hips rest back onto your heels, Virasana, the hero pose where your hips lower down between your feet, as well as the fish pose and the frog pose. But here I need to give you a very important warning. You should perform these more advanced exercises only if your knee joints are in completely healthy condition. Now let me show you one of the absolute best exercises out there. One that beautifully stretches all 4 heads of the quadriceps while simultaneously working the iliopsoas at the same time. Come down onto the mat onto both knees. Place your left foot forward in front of you, planted at a 90-degree angle. Bend your right leg, reach back with your right hand, and pull your heel in toward your glute. If you can't quite reach, go ahead and use that belt again. No hesitation. If your right knee feels too hard or uncomfortable against the floor, simply slide a folded towel or blanket underneath it. Hold this position for 1 to 2 minutes. Breathe smoothly and steadily through your nose, and feel the muscles lengthening and releasing. Then be sure to switch sides and repeat the whole thing on the other leg. To make your trigger point treatment in the front of the thigh as effective as possible, you absolutely need to be working on the muscles of the posterior thigh as well. A detailed walkthrough of exactly how to work through those muscles properly is available right in this video. I'd really love it if you'd support this video with a like and share it with anyone close to you who is dealing with leg pain. Stay healthy, and I'll see you in the next video.